Health screening. Health screening is very important at all ages, but especially for the young children and students, this should be there in place as a facility to take care of the health of the students. Provision of health services to the children and young students in following forms fall under this category. So what is the category where we say this health screening is very important for the young people and the students? Health screening, that means medical checkup of students on regular basis. So this health checkup is not only important for young people and students, rather it is important for all adults as well. So every person, every individual must go for a health screening at least once a year. In the developed countries, sometimes it is twice a year that everybody has to go through health screening. These are the measures taken in order to avoid any unnecessary hassles and any unnecessary problems that may occur in one's health during the lifetime. So in most of the developed countries, it is sometimes twice a year that every individual has to go through health screening. In some countries, it is once a year that every individual goes through a health screening process. Also, in some organizations, it is compulsory for the employees and the employers to go through a health screening process every year once, so that it clarifies that everybody who is working in the organization has good health and there are no serious problems occurring or any symptoms of any disease which needs attention. So in this case, we are talking about the students and children at young ages. At this age also, it is very important for all the members of the school, the students and all the children to go through a health screening process once a year at least, so that anything that is shown in that health screening is taken care of. Referral of students with health problems to medical centers for treatment or rehabilitation. Again, if during the health screening it is found out that there are some problems the students are facing, also if there is a reason or a symptom that shows that the student is facing some problem, even if it is not diagnosed, it has to be followed later on. While the health screening process is taking place, if there is anything which is strange and other than normal, then this person has to be referred to the hospital or the clinic. That is called referral. Referral of students with health problems to medical centers for treatment or rehabilitation. So any such symptom identified then should be sent as a referral to the clinic or the medical center in order to follow up. And then sometimes the doctors would advise some treatment, or they would diagnose and find out if it is a serious problem and if the student needs some sort of support as well other than the treatment. For example, those students who get into drugs or smoking, they will be needing more than just a treatment. More than just a treatment would be rehabilitation in the society. Also, some mental patients would be needing such a support which would be called rehabilitation, because after being treated, again they want to be rehabilitated in the society. And that process has to be supervised by the professionals who are the people who are expert in rehabilitating. So rehabilitation is another concern that is very important, especially for the young people, because it has been always noticed that if some patient is not rehabilitated, then that means he would go back to the same problem again. For example, if there is a smoker and the staff of the school or the teachers, they diagnose it, or during the health screening process it is found out that he is smoking and it is very dangerous for his health, then he would be referred to the clinic or to the hospital for treatment. Along with that treatment, he needs to be rehabilitated, because it is a habit which is very dangerous for him, and it is an addiction, and it will not just mere go away because of the medicine being given to him. He will be needing more of emotional support to settle in the society and also continue with the precautions that are given to him, and then not try to smoke again. This process would be rehabilitation process. Also, the deworming campaigns need to be there in place in order to diagnose and identify the problems and then work on it according to the health screening processes.